case of coronavirus was reported in Kenya, the government encouraged people to work from home. President Uhuru Kenyatta announced a nationwide curfew, partial lockdown, and other containment measures in keeping with the scientific advisories to curb the spread of the deadly virus. Health workers were by default exempt from the partial lockdown and curfew. But it appears the police are yet to recognize health workers as essential service providers. A case in point is the continued standoff between doctors and police manning the border of Nairobi Metropolitan Region at Chania along the Nairobi-Nyeri Highway.
Nilitoka asubuhi mapema nikielekea Keno Hospital kufanyiwa dialysis sababu naendanga siku 2 per week. Hiyo ni Monday na Thursday. Na wakati nilifika mahali bari ya roadblock iko, hawakuweza kuangalia karatasi yangu ama nini, waliniambia tu nipiduke. Nikaenda hapo, nimepiduka mara 3. Saa mara 4 ndio nimekuja nikasimama mahali nifikirie la kufanya.
Doctors who work in Thika and live in Murang'a are often blocked from moving to either sides of the police barrier.
Because when our doctors are stuck in a road barrier, we feel uncomfortable because the patients are waiting for them in the hospitals. We know that we have patients who had other diseases even before COVID came, and they need the doctor's care. So we are not happy when they are being held in a junction, when we are all fighting for this virus, which we cannot see. We would not want to create an enmity between security forces and the doctors and the medical fraternity.
The police want even the doctors going back home to have a written note from their bosses.
You are supposed to behave well. Yeah, but going like this, crossing the roadblock all the time, we will not allow that. And if it happens that you must cross, then your representative doctor will be telling us who is who. I think I'm clear.
KMPDU Acting Secretary General Chibanzi Machonda says that the police keep harassing health workers on their way to and from work, even after they identify themselves.
Unfortunately, the police are still acting with brutality and using excessive force. This is an act of hostility against healthcare workers who are deemed and are supposed to provide essential healthcare services. In view of that, as KMPDU, we have today morning resolved that for the safety and protection of our healthcare workers in that region, they shall go back home until such a time that the relevant authorities implementing this directive shall feel that doctors are important to serve Kenyans.
Machonda is also calling on the government to put an end to the production and distribution of fake personal protective equipment. The fake PPEs have since made their way into health facilities, and doctors fear they could be at higher risk despite their sacrifice in fighting the coronavirus.
And equally, we urge all healthcare workers to be extra vigilant, to report and reject any PPE that is of low quality, because this will pose a danger to themselves. The paramount issue here is the safety and protection of the healthcare workforce.
The doctors also want the police not to use quarantine centers as prisons for people who are arrested breaching the curfew.
If we overload the quarantine centers as we speak, the health workforce that is already strained will be further strained. It will be exposed. It will further be exposed to infection, and we do not want a situation where those who are manning quarantine centers also undergo quarantine.
Aaron Kipkoech, TV47, Nairobi.